Hello and welcome. You're watching India Fights Back, our special show where we take a stock of the battle against COVID-19 pandemic. I'm Vishal Dahiya, and with me are two special guests today. We have Urvashi Prasad, the public policy specialist from Niti Aayog, and Dr. Samiran Panda as well, the member of NEGVAC and also head of the ECT division at ICMR. Welcome, both of you. And today we're going to talk about something which the Prime Minister, in his address to the nation on Tuesday, emphasized, that is saving lives and livelihood as well. As all our viewers are aware, we are in the middle of the second wave of COVID pandemic across the country. And there are huge numbers which we are battling with in terms of the patients who are turning out COVID positive, as well as managing hospital facilities, and also the bigger challenge here to ensure that the economic activity, the livelihood of the people does not take a hit again. So let me begin with you, Urvashi, and let's start and identify not only the key takeaways of what the Prime Minister said on Tuesday, but also how are we moving ahead in ensuring these two things. Saving lives obviously is the primary motive, but so is saving livelihood.
Right. So I think, Vishal, as far as the Prime Minister's address is concerned, I think his overall objective was very clear. He wanted to reassure the people that the government is acting with both speed and sensitivity, as he said, and trying to manage in whatever way possible this very, very difficult situation that we have been faced with over the last few days and weeks. So I think as far as the health side is concerned, it's very clear what we need to be focusing on. We need to be focusing, as he said, on containment, and he emphasized the micro containment, which also links to the aspect of livelihoods, because the more we can have smaller, more tightly defined containment zones, it's not only more effective to manage the pandemic, but it also means that we can avoid very large scale lockdowns. So I think that is one aspect of it. Testing is something that we are continuing to push ahead on, including thinking of innovative means of expanding testing, because as you know, the positivity is very high in certain areas. So we definitely need to bring in additional testing capacity and use innovative channels there. But the oxygen point is also very important. And I think that is right now something which the country and the health system is grappling with in a big way. And he also highlighted many of the steps that are being taken to expand not just the production of medical oxygen, but more so also the distribution, and make sure that it actually reaches where it's needed. So I think a lot of those steps, aside from vaccination, which as we now know has been opened up after the 1st of May to all adults, and we will have to make sure that the supply really keeps pace with the heightened demand that we now expect to see. So I think all those measures which the government is focusing on, he also touched upon those. And of course, he did say that we have to try and minimize large-scale lockdowns, because it does cause a lot of inconvenience to the poorest, the most vulnerable. He also spoke about steps that we are taking for migrant workers in collaboration, obviously, with the state governments. And some of the measures which were introduced last year are now going to be brought back, because we again have a migrant issue and crisis in some areas. So I think those are really broadly, the key points that he made, as well as the areas that we have to focus on right now to manage this situation.
Okay, indeed, and all these aspects are closely intertwined there, be it the testing, tracing, tracking, and treatment of the COVID positive patients is concerned, or the vaccination out there, and other steps which you mentioned, Urvashi. Let's look at them one by one. Let me bring in Dr. Samiran Panda here. Dr. Panda, looking at it from the saving lives point of view, as Urvashi was pointing out, and as is pretty much evident now, what is required is to give more focus on testing more and more people, so that we know that no one is left behind, somebody who is showing symptoms or is actually COVID positive, because that would again form a chain and create larger numbers. Also managing hospital and other facilities like oxygen availability, as Urvashi was saying, even from the pharmacology point of view, various medicines out there. How are we moving ahead on all these aspects?
Well, Vishal, you did talk about two things, two very important things in continuation or in relation to Honorable Prime Minister's speech. Testing. What does a test do? Testing at the population level in sufficient number helps in categorizing a district. So the major focus is not talking about the country as a whole or even the state as a whole, but going farther down and at the granular level of districts. So the moment we are able to categorize the districts, if any district, for example, is having a test positivity rate of 10% or more, naturally the intensity of the disease and the spread of the infection is much higher there. And those districts which are below, let's say, 10% test positivity rate, they probably would require a different intervention approach. So that's why testing is very important. But in order to calculate the test positivity rate, if we are not having enough tests, then we won't be able to categorize, or we wrongly categorize the district, and then the intervention would be wrongly designed or implemented. So that's why testing is very important. I'm talking about not only the individual level benefit of a test, because as you very rightly pointed out, Vishal, that if you test, then only you know that you are infected or not infected, and there at the individual level, what could happen. Most of the people who are contacts of a confirmed positive case, if they get tested and are found out to be test positive by RT-PCR, but did not have any symptoms, so they are asymptomatic, positives detected through RT-PCR, and they were contacts of somebody who was confirmed a positive case, and as they are asymptomatic, they can be managed at home. So that will be one advantage.
Okay.
The second advantage is if somebody gets tested as positive, he or she need not to necessarily panic, because there are 3 stages of the disease: mild, moderate, and severe. Mild cases who are confirmed positive, they can be managed at home if a proper home management package or kit is used. And what would they entail? I would talk about it shortly. But those who are moderately ill, if their oxygen saturation is fine and their temperature is being monitored at home, that's fine. But the moment they see an indication of oxygen saturation going down, they should consult their physicians and go and get themselves admitted in a COVID care center or an appropriate treatment center. So that's at the individual level. But when sufficient number of individuals in a district would be tested, and then we'll see that the test positivity rate is beyond 10%. So you know that there, not only it's the demand for care, which is going to be very high, from there the disease transmission is also going very fast. So the prevention measures also need to be beefed up. And along with these two, one cannot neglect the issue of vaccination, because vaccination will again benefit the care-related issues. If you give me half a minute, I will be able to explain why so. We all know...
Please go ahead. Please go ahead, Dr. Panda.
Sure. Thank you. So we do know that what does the vaccines do? They do prevent us from proceeding or moving ahead to the severe stage of the disease. It also prevents us from getting admitted to the hospitals, the requirement for oxygen, and even helps us to avoid deaths, as we all know. So while a person is not progressing to the advanced stage of the disease, he or she would not go to the hospitals and there would be crowd. So the COVID-19 related care has been now replacing the non-COVID care. But those are being neglected. For example, the multi-drug resistant tuberculosis, routine immunization program, maternal and child health, maybe surgical procedures which need to be taken, oncology care. So all these cares are being neglected or are being pushed away because of the large crowd of COVID-19 infections, which are in moderate stage or advanced stage, and therefore naturally require in facility care. So vaccine would not only offer the individual level benefit, but at the population level and at the healthcare system level benefits would be very obvious. That's why it is high time we ramp up the vaccination, no hesitation, about taking a vaccine, no time taking in terms of choosing which one should I take or not. So if all these things are put in place, I think that will be the way forward. But the whole intervention plan should be at the district level, and there again, not only the district health authority and the district administration, but also community engagement will be a great combination to move ahead.
Indeed, indeed, that is the need of the hour, and we've been, witnessing how several in the community are coming forward and doing their bit in terms of not only educating others but also helping those who are in, dire need of support there. Let me, come to you, Urvashi. Now, this is about saving lives. When we are talking about the other aspect of this battle, that is saving livelihood, and you referred to some points there. We also remember how the finance minister just a few days back also said that we have to focus on ensuring that the economic activity does not take a hit. And quite clear hints coming in there from both the finance minister and the prime minister there that lockdown, the entire nationwide lockdown, is not the solution. So what kind of strategies do you believe are being implemented and should be implemented to ensure that we win the battle against the virus as well, and we don't lose on the livelihood part also?
Yes, so I think there I think it's very clear that the lockdown is not going to take the virus away, or it's not going to take the infection away. What it does is to prepare our health system either when it is faced with a complete unknown, as it was last year, or when it is overwhelmed, as unfortunately in some places at this point in time that has been the case, whether it's in Maharashtra or in Delhi. There have been instances when obviously the system has felt overwhelmed with this large number of cases. So these curfews or curbs or limited lockdowns have had to be introduced. So I think that point is very, very clear. And there a collective responsibility comes in, because the more each of us do our bit to make sure that we can minimize the pressure on this health system, and the health system only needs to deal with people who really need care, only people who are at that level of disease. For most of the people, if we can either avoid infection, and of course our best weapons there are our COVID appropriate behaviors, and for others who do have mild to some extent moderate infection, if we can manage them better outside our hospitals, that is really our best bet right now, because we really don't want to, and I think that is the messaging that has been coming from the top as well, go in for a large scale lockdown at this stage, because all it would do is disrupt everything that had started slowly coming back on track. And this doesn't just mean the formal economy, but more importantly, those who are in the informal economy, the migrant workers, the labor, etc. Those people get the worst hit and the most inconvenienced when we have to do a large scale lockdown. So I think if we want to avoid that, and I think it's very clear that all of us, including decision makers at the highest level, do want to avoid that, we have to make sure that the COVID situation remains within the health system capacity and it does not consistently overwhelm it, because if that happens, then we unfortunately would not be left with a choice, because lives, as the Prime Minister has said from the beginning, is obviously our biggest priority in the midst of a pandemic.
Okay. Indeed, that is a very, very important aspect out there as well. Coming back to you, Dr. Panda, since in your first response, you concluded by, pointing out how vaccination is a very, very important aspect of this battle against COVID pandemic. Now, if you could make our viewers understand where do we stand and what's our strategy in terms of, the new policy which has been announced about people above the age of 18 being eligible for vaccination from 1st of May onwards, as in how many in terms of both supply and demand, as well as the entire, distribution network, the chain, how it is working, what is being done to, step up all these aspects, because then there'll be a lot of demand coming in from 1st of May onwards.
Yes. So in continuation with what Urvashi ji said, I would, carry on from there, saying that while things are gradually coming back to normalcy, meaning shopping malls, businesses, educational institutes were opening up, so young adults went out in order to get into their normal rhythm, and even children were starting to attend or go to the tuition facilities, or there were discussions about opening up schools, and then came the second wave. So here, while the whole nation and respective states and the districts, they were planning their own coming back mechanism to normal speed in terms of development and livelihood, the second wave hit us right then and there. So clearly, if we do not want to compromise with the development process and the economy and the negative impact on the economy, but at the same time, we cannot afford to have the infection spreading that much and not overwhelm the healthcare system and don't push it to the verge of collapse, then we have to have really a smart combination of moves. So what are those moves? So as I talked about the 10% test positivity rate in a district, that is an epidemiological information. So based on the epidemiological information, if local level restrictive measures are applied, then we are still able to contain the spread of the infection. And it's all about 14 days incubation period. So if a district wishes to have local level restrictive measures, and if they, through community participation, maintain these restrictive measures for 14 days, then you are actually robbing the virus of its opportunity of spreading from one to another. So it's all about not allowing infected individuals to come to close proximity of the susceptible individuals. On the other hand, if the vaccination drives go in the same districts very effectively, rapidly, it gets scaled up, then even if there is acquisition of infection following vaccination, those individuals will not move into the advanced stage. So the pressure on the healthcare system or pushing the healthcare system to the verge of collapse can be avoided. And thirdly, those who unfortunately will be in moderately severe or severe stage of the disease, for them, the hospitals or the treatment facilities can still offer care, while other non-COVID care can also be addressed. So the point I'm trying to make here is that vaccination is one of the major tools here, but while getting vaccinated, we all should remember that that does not mean then that we can do away with our masks. No way. If we are fighting with somebody with a sword, and sword in this case is vaccine, we do not put our shield down. Because if you put your shield down, then the opponent will hit you with its sword. So what all I'm trying to say is that when we will be getting our vaccines, at the same time, we should have our face mask properly used. Because in the name of face mask, if we use chin mask or neck mask, that will not prevent the infection. So this is very, very important for us to appreciate that following vaccination, it's possible for us to get infected. We will not fall severely ill, but we'll be able to pass it on. So by that, we will not be able to break the chain of transmission. So it's not one or other, it's both. And the other COVID appropriate behaviors.
Indeed, these are very, very important aspects out there, and quite effective as well. But there's one more thing, Dr. Panda. And this aspect is also equally important in this battle against COVID. That is understanding how the virus is moving, understanding more about the virus. And therein comes, something known as genome sequencing. We've explained to our viewers in our earlier shows as well what exactly is genome sequencing, what are we doing. But to cap it up and to understand much better, how are we, moving ahead on this part as well? Because it is really important to understand the virus as well, so that we can, predict and plan accordingly.
You hit the nail right on its head, Vishal. You are talking about the virus, and let's talk about the behavior of the virus and then behavior of us. So while the viruses proliferate, be it RNA virus or DNA virus, they do go through a process of change. And not that they do it deliberately, it's a random error that takes place. But while we copy a text from an original book, then we do some errors. But at the time of final reading, we do the proof correction. But the viruses do not have proofreading system, so the errors remain. And those changes are called mutations. So the mutations of the mutants are ought to happen. However, we need not to assume that all the mutants are going to be very deadly or fatal. So mutations will happen. These are errors, and sometimes even part of the genes can be deleted. So these are called variants. Now, all these variants are variants of interest, because with interest, we study them. But not all the variants of interest, which are called VOI, are variant of concern. Variant of concern, or VOC, are those variants which are either easily transmissible. So from epidemiological data, if you can figure out, like in Punjab, we know that there was UK variant which was spreading fast. Or if there is a variant of concern which is killing people very rapidly, that is a variant of concern. That comes from clinical data. So from epidemiological and clinical data, when a variant is clearly found to be associated with either rapid spread or rapid fatality or complicated disease, we call them VOC.
Okay.
Now, you are talking about mutants, the whole country is talking about mutants, and double mutants is one. For example, double mutants have been identified not only in Maharashtra, but in other regions of India as well, and also in other countries. But it's still a variant of interest, not variant of concern. So I am saying that, well, these are being mapped through the countrywide network. That's called INSACOG, and there is a mapping exercise and cataloging exercise. However, be it new variants, be it old variants, they all use the same route of transmission. So let us not compromise with our prevention measures, which are time-tested and proven.
Indeed, and therein comes the COVID-19 appropriate behavior as well, which both of you are pointing out. Urvashi, a quick concluding comment from you, because all of us are aware right now that the healthcare system is under tremendous pressure because of the exponential increase in the number of cases, in all major cities, various states, and smaller towns as well. We've seen it happening, and the onus actually now lies upon all of us to ensure that this pressure does not, go to an extent where it sort of causes irreparable damage to the healthcare system. So to understand things better, what can we do, people like you and me, common man, common people, and also what have we learned? How has our health system evolved since, the COVID hit us last year from the first wave till now?
Yeah, so I think, this is something the Prime Minister also touched upon yesterday, that we have definitely learned a lot. Where we were last year, we are not at the same place today, fortunately. We do have many of our supplies much more in place. Last year, remember, we were struggling even for masks or PPE kits in many areas. We did not even know of the basic sort of management protocols. How do we even manage a patient who has this? How do we escalate it to different levels of care, etc.? So the advantage is we do know all of that at this point. Now, of course, what the system needs to do is very clear in terms of, testing, in terms of, micro containment, ensuring that those who need hospital support have the oxygen, have the medication and the vaccination, which of course has been emphasized a lot, that we do need to really boost up our supply, because hopefully demand after 1st of May is going to go up a lot and hesitancy will go down, especially because we've seen this surge. So I think what the health system needs to do, what the government needs to do is fairly clear and well understood. I think as citizens, the best we can do is continue to adhere to the COVID appropriate behaviors that we have learned over the last year in terms of our, wearing masks, our hand hygiene, maintaining distancing as much as we can, as well as being very careful about poorly ventilated spaces, poorly ventilated indoor spaces, and make sure that we don't have any crowding, especially in areas like this. And the other thing we can do is that as soon as we are eligible, which most of us are going to become eligible after the 1st of May, go in and get the vaccine that we can get. Let's not worry about which one or its precise efficacy. Let's not get into those details, because eventually with vaccines, the more critical mass that we have, of people getting the vaccines, the more effective as a whole it's going to be for us. So I think those are the two things that we can do, apart from obviously helping each other get better access to facilities, which I think many volunteers, many citizens are anyway doing. But to protect ourselves and others, these are the two best weapons that we have. And the more we use of these, the more we will reduce the pressure on the health system at this time.
Indeed, it is on all of us. The onus lies on all of us to go ahead and help in this situation right now. Thank you so much, Urvashi out there, and Dr. Samiran Panda, for taking out your valuable time and making us understand these nuances of how to go ahead and save both lives and livelihood. Before we go, let us also remind you, as our experts have been also reminding all of us for quite a while now, about the importance and significance of adhering to the COVID-19 appropriate behavior. It's a simple three-step process. First is you have to wear your mask at all times whenever you are out there in public places. Also ensure that you wash your hands regularly. Hand hygiene is equally important, and so is maintaining physical distancing from others of at least 6 feet. These 3 simple steps will go a long way in keeping you and your near and dear ones and everybody else in the society and country safe and secure from COVID-19. So do not forget to adhere to this COVID-19 appropriate behavior, and stay safe, stay secure, and take care. Thank you.